Hello, and welcome to Cutting Edge Health. Today, we are talking about sleep and pain, a pretty common topic that comes up fairly frequently. And again, what we're talking about is sleep and pain and potentially mistakes that can be made. And what we want to be able to give you an idea about is how to be able to avoid those mistakes and how to be able to make sure that you can be able to improve your sleep, decrease your pain, and have an understanding of what to do with both. If we haven't met, I'm Dr. Orlando Landrum, founder of Cutting Edge Health. And what we hope to be able to do is to help you be able to understand how to be able to punch pain in the face and get back to leading the life that you deserve. So today we're going to do things a little bit differently. We're going to talk about what the different articles are that we're going to be reviewing. As you guys know, for those of you who join us with frequency, what we do is not do Instagram or Facebook kind of postings, which are like blog pieces that say, well, this is what I think, or this is how I feel. Instead, what we do is actually go to the literature and find scientific studies that have actually been reviewed, analyzed. And what we do is take a look at some meta-analyses. We see, so just as an aside, meta-analyses are a combination of looking at different articles to be able to evaluate, is this a good article? Is it not a good article? And all of this is done with a research rigor so that it's not just about what someone feels or thinks, but how they've been able to identify that this is going to be of value or not. For those of you who join us with regularity, we appreciate you returning. For those of you who are new, what I really want you to emphasize is although we're placing a strong stance on science, we are not making this be haughty and unapproachable. So if you're tuning in live, one of the things that I want you to do is to reach out with questions and concerns. No question is too small. We'll be happy to answer it during the actual context of this live stream. And if you are missing it and you're catching us at a later point in time, first, hit that notification button so you know to join us live in the future, but also leave a response and we'll see what we can do about answering your question. For those of you who are kind of sending us messages already, I appreciate you guys being in place and tuning in as always. I really do. And that's not trite. So let's talk a little bit about sleep and pain. I think right off the bat, most people say, oh, you know what? Well, hey, I know that my sleep's going to be affected. It's going to potentially make my pain worse. And I think in some ways, those things are pretty intuitive. What we want to figure out is, so why is that the case? And what's the science behind it? So we're going to look at a number of different articles. So I'm going to give you the different articles that we're going to examine. And then we're going to talk about how those articles kind of all tie it together. So first and foremost, let's take a look. And all these articles you can find on PubMed. So in essence, you can use Google Scholar to be able to get there, or you go to PubMed directly. And all these articles are free. So you can be able to take a look at it. For those of you who are my patients, if you want to talk about them individually, go ahead, look it up, and I'll be happy to kind of have a conversation with you about what this means and how to be able to interpret it. Okay. So as we kind of get into that, one of the things that we want to see is the first article is sleep deficiency and chronic pain, potential underlying mechanisms and clinical implications. As you guys obviously kind of get that, in essence, what we're going to do is take a look at how sleep and pain are interrelated and what are potentially some of the causes. Next article that we're going to look at is Sleep and Pain, a systematic review of studies of mediation. So this is really going to assess and analyze a number of different ways and how studies have really kind of been put together. And we're not going to take this in chronological order of paper by paper. We're just going to kind of look at the data and then field questions and kind of give you what's a summarized response. The next is an NIH manuscript that is kind of a meta-analysis of different data that was published in the Journal of Pain in 2013. So it's about 10 years or so ago. The Association of Sleep and Pain, an update and a path forward. And this is basically a review by a number of different areas, but Johns Hopkins being one of them, and how there's speculations about how to be able to look at pain in a different way. Sleep spindles as diagnostic and therapeutic targets for chronic pain. I know that sounds fancy, but the reason why we're delving into this is so there are ways to be able to measure and look at sleep. This particular article is going to seem a little far removed because it's looking at a human model. It's looking at rats and it's looking at how they kind of are able to be measured in terms of how their spindles may be a treatment option if we focus on it for improving pain by doing a number of different measures. Then in addition, what we're going to do is take a look at is sleep position associated with glenohumeral shoulder pain and rotator cuff tendinopathy. So The reason why I threw that study in, even though it seems to be focused mainly on the shoulder, is many times I get from patients, is this the best sleeping position in order for me to avoid pain? The fact of the matter is, taking a bit of a divergence for a second or so, there's not going to be one sleep position that's going to be best. But there are certain things that can be able to make your pain possibly worse depending on your position. And this is looking at specifically the areas of the shoulder and the shoulder joint and how that might relate to the neck. So for many people, when they sleep, they end up getting pain in their shoulder, or sometimes they'll get that tingling sensation will be present in their hands. And so it talks about different positions. Okay, let's see. And then we're going to take a look at an article that talks about cannabinoids and endocannabinoids and sleep. And we've covered a little bit of this before, but in essence, instead of using the fancy word, it's going to talk about one of the things that's all the rage now is using a CBD gel or CBD capsule before bed, and maybe that helps with sleep. And so we're going to cover those in kind of a differing blend and mixture. So if there's certain things that you guys want to hear more or less of, by all means, please pose a question and we're going to get started. Okay. But those different ones that flashed up, you can be able to review it at a later date, take a look at the articles themselves and kind of get the summary for yourselves if you're interested. Okay. So one of the first articles actually, it was kind of that generalized overview. And one of the things that they come up with is the following kind of paradigm. And that is that impaired sleep can be equivalent to higher pain intensity. And I don't think anyone who has pain, this is some revolutionary, novel concept. What we know, though, is that impaired sleep and high pain intensity is certainly mediated by mood, i.e., many times people think, you know what, hey, I'm just sleep deprived and I'm slightly cranky. Well, sometimes that can be a chicken and egg type phenomenon. And you can see this in the bottom graph that has sort of this circular or trapezoidal type appearance where you have sleep in one corner, higher pain intensity in the other, and then kind of above it with this sort of connecting area of this low mood. There are thoughts about whether depression itself influences pain and influences sleep. And so the reason why this pops up is historically we've kind of separated mood and feeling from how we kind of process the aspect of pain. And what many of these studies have kind of said with a repetitive phase is that's incorrect. What we may need to do is address the mood, potentially with a separate type of treatment modality, in order to be able to improve both sleep and pain, with the thought process originally years ago, decades ago, of saying, well, if we improve this noxious stimuli, let's say that we use a pain medicine of some sort, then I'm going to sleep better. Well, not necessarily, particularly if you have a mood disturbance that also needs to be able to be addressed. And that mood disturbance or issue can come from possibly pain and be a secondary issue, or it could be a primary issue. But at the end of the day, we can't neglect that and expect that sleep's going to be improved. The more robust example of that is the following. And so as you saw that original trapezoidal picture, you can see that it actually is more prominent when we take a look, and we can see that first you have the elements of negative mood and a number of different papers that represent it. Then depressive and anxiety symptoms, which we didn't talk about before, but anxiety certainly can be a causative factor. Then the focus on pain or attention to pain, and pain helplessness being that element of not feeling like you can be able to improve it. And then we start talking about physiologic means. So things like activation of the stress system. And so this is going to be that hypothalamus, the pituitary adrenal axis that's in place. And then fatigue, just in general, separated from pain. So all those things are confounding variables that all interrelate and can particularly cause that pain and sleep to be worsened. And many times science and scientists on one end and bedside physicians and nurse practitioners and other clinical individuals don't really look at the behavioral health piece. And as a patient that is looking to be the best advocate for yourself, you may have to really say, how can we be able to intune that concept of what you're feeling and talk to it about your provider, because that can actually be able to improve things and lead for you needing less traditional pain meds or analgesics. All right. So one of our papers looked at what are the mechanisms? How does all this work? The next slide is going to be a little bit daunting, but bear with me. So it is a listing of all the different ways that sleep is impacted physiologically. So you can see there's three different categories and three columns that are in place. One is analgesia, one is analgesia or hyperalgesic, and the other is hyperalgesic. So what does all of that mean? So a quick summary of what these fancy terminologies mean, because I know it sounds super involved. And what I want you to understand is that we're going to make this able to be digestible and that it's going to be able to be understood. And for those of you who watch our channel frequently, what we're going to do is explain it like you're 5. Not to say that you are 5, but so that you can understand exactly what we mean. So there are different physiologic systems that are present in the body. Most people, when they think about opioids, they think about an outside source. They think about opioids being a treatment that is a medication that's bad and that's evil and is coming and is going to be a Vicodin or morphine or other medicines that are going to potentially be a problem. But we have natural receptors for opioids. We produce our own endogenous opioids. So if someone has ever heard of a runner's high, you can frequently be able to have some of those things that are painkillers naturally. And that opioid system has a lot of things to do with pain. So as we take a look, we can see that that opioid system, when sleep is impaired, it can respond to opioids, regular exogenous opioids, differently. There is a system that's called the monoaminergic, as well as dopamine, and those have their own issues. That monoaminergic also connects with something that's called norepinephrine. And all of this, dopamine, norepinephrine, serotonin, they all have kind of these interrelations that influence how well systems function and what are going to be both your sensations as well as your degree of awareness. There's melatonin, which people have heard about traditionally for being able to be utilized, and endocannabinoids is a system that exists. And an endocannabinoid system is the system that THC as well as CBD works on. In one of our earlier talks, we talked about this, much how you have a natural opioid system that has receptors that respond to natural opioids. In our body, we have an endocannabinoid system as well. And what that system is a system that does homeostasis. And what that means is it regulates how the body should naturally function, how the heart rate should be at a certain rate, how you should produce certain proteins and exogenous chemicals, and rather endogenous chemicals that are present. And it is kind of a relatively new system from what we found about, but it actually influences things like the nervous system and things like the endocrine system, which produces different things like cortisol and adrenal. It sits above all of those and can be able to provide homeostasis. And when sleep is impaired, that system can be impaired. Then we talk about things that can cause potentially both slight pain, less pain, as well as increased pain. And these are the systems that I kind of referred to before. So if you have an increase in cortisol or you have a change or decrease in serotonin, you can have some of those things take place. That's that purple column, if you take a look at this. And then the right side column in red is hyperalgesic, meaning more painful than what you would normally expect. And you can see that with an increase in adenosine or a change in nitric oxide or different substrates that are present within the immune system, like prostaglandins or cytokines. So things like interleukin 1 or interleukin 6. So I know all of that is fancy terminology and I get it. But at the end of the day, I want you to be able to kind of refer back to this video so you have an idea about there's a lot of different things that are present in the body that are a blend of how pain can be related. It's not just a feeling. There's physiology behind it of how the pituitary and adrenal system is a portion of it, how the endocannabinoid system is a portion of it, how the various different elements of monoamine and our natural opioid systems can be impaired by sleep. And they are kind of the mediators between this. I think we got a few questions potentially coming in. Oh, okay. So I think we got some people telling us that's here, and we have some people saying it's a little bit out of focus. Well, we'll see what we can do about trying to be able to address that for you. Okay, so in regards to kind of taking a look at those systems, let's kind of go in a different direction that sort of connects it from a little bit of a 20,000 foot view or higher level. So I'm not sure if you guys can be able to see this, but as we can see, there's this circular function of pain and sleep deficiency. And so when we take a look at that, one of the things that we can kind of be able to determine is that there's a number of different mediators of that. And so across the circle, and I'll try to see if I can kind of give this to you in a different type of way, so that way you can be able to understand what's happening, is there's a few different things. One, hold on a sec. So one of the things that you can be able to see is that there's medications can be able to disturb sleep. And historically, that has been kind of a little bit of a different type of thought, that when we talk about sleep as a whole, we're normally trying to use medications to see if we can be able to provide better sleep by taking medicines. But many times that's kind of an incorrect approach, because by doing that, you can not only become dependent on that medicine, but it ends up resulting in less benefit than what we originally thought was possibly the case. And then you can take a look at timing of medications and whether it makes sense to take those medicines towards the end of the evening, and how that can potentially be impactful. In addition, you can be able to see that there is definitely a role in lack of sleep contributing in terms of a short-term pain, resulting in it becoming a chronic pain. There's also the aspects of, do you have a good support system? And is that support system causing problems with being able to manage sleep, and ends up resulting in challenges that are in place? Then looking at the quality of the sleep, which is one of the things that we're going to talk about when we take a look at those elements of the sleep spindles that were referenced earlier with the non-human model system. And finally is the recognition of postoperative pain for procedures, and how that postoperative pain changes can cause some of the problems with sleep. Okay. So let's take a little bit of divergence, because I know this is kind of like high and mighty, and let's kind of give you something that's a little bit more tangible. So that one article talked about how positioning could potentially be a problem. And one of the things they did is it evaluated a couple different parts of the body. So it looked at different parts that can give you an issue, from the areas from the neck to the shoulder to the aspect of the scapula to the elbow. And what it really looked at was, were these different areas more likely to give you a problem based on the following positions? And so as you can kind of see, there's the fetal position, there's kind of this log position. So these are all sleeping positions, as you can kind of see it clearly demarcated in the sheet. You could have a soldier position where you're laying flat on your back. You can have a starfish position where you're flat on your back, but with your arms up. Or you can have a free faller position where you're in face down or prone position and your arms are up. Well, interestingly, this study was actually predicting that the free faller position would be the worst. And what they, particularly for shoulder pain, and what they ended up finding is that, for whatever reason, as they put it paradoxically, is that that shoulder position and a free faller position for those people that sleep on their stomach is not as problematic as what most people originally thought. One of the reasons why it was postulated that it was going to be an issue is because, number one, the muscles of the rotator cuff are in tension in that position. And many times that extended position like that can cause a lot of different problems with tendinosis that normally exists. Two is that you can have problems with vessels and vasculature trees that's there. Three is that you can have some stretch of the brachial plexus and the nerves that exists in that position, but it's actually not quite as bad as what most people think. Okay, let's see. I think we have a question coming through. As for chronic pain, I've experienced the interrupted sleep throughout the night, and this does contribute to excessive increase of pain. Yeah, so I think that, as we kind of showed in that first article that was showing the circular component, is that pain can worsen sleep, and sleep can worsen pain. And I think that there has to be kind of a break of that vicious cycle in order to be able to kind of get a better response. So one of the things that we have talked about is that there's an element of looking at endocannabinoids and whether they might potentially improve things. So endocannabinoids are like things like CBD, right? So one of the studies that looked at that, it looked at a number of different things, but it looked at the areas of the synaptic cleft. So if you look to the top portion, or rather on the left-hand side, you can see there's a presynaptic neuron, and then you can be able to pick out and see that there's a postsynaptic neuron. And at the end of the day, endocannabinoids influence that through a number of different channels. So there's a CB1, a CB2, and there's also a TRPV1. But be that as it may, at the end of the day, without getting super fancy with it, it has molecular mechanisms. And those molecular mechanisms can be influenced by sleep, and they can influence sleep. And so can endocannabinoids be used, that system be used by exogenous or extraneous cannabinoid type elements to be able to improve sleep? What they've seen in some of the aspects of the science is that, yes, it can be. So you can be able to see that it's definitely interrelated, and some of those medications can be able to improve it. The question, though, is what do you lose when you use an exogenous element, whether it's an opioid or endocannabinoid? Well, what happens is that many times that system becomes needing of that exogenous piece in order to be able to kind of get some degree of relief or improvement. And the reason why that happens is many times those receptors can be able to downregulate. So what's being said is something that's been said for years or eons, and that is all things in moderation. So if you were to use something like that with an intermittent use when you needed it from time to time, may be a good practice, but using it with consistency is going to attenuate or decrease its efficacy, or how likely it is to work over and over again. Okay, let's see. We got another comment coming in. Have been a chronic insomniac entire life, never put sleep and quality of sleep together till about 10 years ago. Docs need to address this. Yes, Ms. Stangby, I'm trying. So, yes, I agree that sleep issues can certainly cause problems with pain. And I think that it's one of the things that is challenging. There are a number of physicians that focus on elements of sleep, but not every doc does. And there's not training for every doc in regards to sleep. So many times when you talk to your clinician who's kind of helping managing that, most of the time they need a referral or a reference on how to be able to kind of get some insight on how to be able to help. Okay, so let's kind of like pivot for a second and take a look at an unusual model system, which is this rat model system. And I know that this may not necessarily be the most clear, but I'm going to do my best to kind of explain it. So at the end of the day, what is taking place is they are taking a look at the elements of these rats, one of which is control, which means it's uninjured, and the other, which is an injured rat system. And what they're able to see is changes in sleep spindles. So the spindles, as you can kind of see, are what's being measured in sort of that third horizontal bar. And what you can be able to kind of deduce is that there's different movements that are measured during sleep, which indicates the degree of awakeness and other things that are in place. And they're able to detect that rats that have more pain actually have kind of the following representation, and that's this. So what you can kind of make out is the following. So you have these treated rats, which are the ones that are present in black. And then you have the ones which weren't affected, which are kind of the control, that are present in purple. And what you end up seeing is that spindle density, which we want, is affected by those that have pain. And that little star that you can kind of be able to kind of pick out there on the far left hand and the top upper left hand corner is statistically significant. And at the end of the day, what all this basically means is that the rats that have pain, that they actually have less spindles. Their density of spindles are less, and it results in poorer sleep. And the picture to the right shows this element of something that's called allodynia, which you heard referenced before. So allodynia, again, breaking it down for everyone to be able to understand, is that presence of pain. And what you can kind of be able to pick out, although the color is not really clear, is that straight line that's at the top that's indicative of not really having much change. Those are the rats that are the control rats that haven't been changed. The ones that are the drop down and that smaller number that shows an increase in pain, it's kind of an inverse scale there, are the ones that have been injured. So at the end of the day, what the heck is all this supposed to mean? And why are we talking about rats? The reason why we're talking about rats is because we can't actually injure people, and we do need to be able to study sleep. And the problem is we don't have enough pain patients to be able to assess and evaluate sleep as one whole collective. And what they've been able to do is to measure this really unusual measurement of really the quality of sleep based off of these sleep spindles. There are different ways to be able to promote sleep spindle activity, but at the end of the day, the short answer is this: that pain impacts sleep, and it can be measured and seen how it's impacting sleep. And to be able to change that particular metric may be able to not only improve the quality of sleep, but hence also potentially the quality of pain relief that can be acquired once sleep is improved. Okay. This is a different reference to a rat model. As you can see, it's pretty prevalent. And this reference was actually in relationship to that endocannabinoid paper that we talked about before. And one of the things that they are able to see is there's certain things that seem to give more problems than not. Such so that you can be able to kind of pick out that portion that looks on the right-hand side that takes a look at humans and what you can, which is obviously our primary care and concern. And what you can be able to pick out and see is that the human population, if you have toxic intoxicants, you can see that there's traditionally an increase in terms of pain that's present. If you continue to use different substances with significance, i.e. so different like medications that try to be able to improve sleep or pain, that you can see that is kind of like a not so much of an improvement. And then if you take some of those things away, you can see an improvement. So at the end of the day, what we can see is that there's some similarities between the rat model system and humans. And one of the things that is of note is that maybe, and this is a little bit different because the two studies are not one and the same, is that perhaps endocannabinoid system is one of the primary reasons why you may have deficiencies and changes in sleep if you can't be able to modulate that. Okay, let's take a quick look. Okay, so hold on one second. There is another comment that's coming through. We're targeting the nerves that send the pain signals help instead of opioid medications. My apologies if you already addressed this. There's no apologies necessary. We haven't really talked about it. We're kind of going through some of the basic science piece. So let me take a step back for a second. So when we talk about how to be able to target nerves, either through an intervention or through a medication, both of those things are focused on something that's called nociceptive pain. And what that means is, so let's say you have a nerve and that nerve gets stimulated on one end. It carries a signal until it gets to the end that tells us, hey, this is what's going on. Sometimes that's good, but in this case for pain, sometimes it's bad, right? So you're having this signal that's coming through consistently, even though whatever's going on is starting that signal isn't something that we really need to know about, or it's an ectopic firing, meaning it's firing on its own. One of the ways to address that from a medicinal standpoint is to use nerve pain medicine, something like maybe gabapentin. You might be familiar with it. Or another way of trying to address it, though traditionally not as elegant, if you would, is to be able to do something like an opioid medicine. Why is it not as elegant? Because the receptors, as we've been shown in the different pictures, doesn't quite match up with that type of firing, and it works a little bit differently. So you have to use more in order to get more. And it's not as easy when you can use something else that's a little bit more targeted and use less to get the response. When you talk about using some type of treatment, blockade, injection, or something of the sort, what it looks to do is to try to be able to do a similar stoppage or halt of that signal that's coming, that's we are really looking not to have, and do it in a different dynamic. So that's nociceptive, or kind of that element of pain that is more dealing with a true anatomical physiologic piece. However, there's also an affective component as well, which means how we process it cognitively, how it makes us feel, and how that can regulate either up or down. That's why some people talk about the elements of mind over matter and how you might be able to kind of decrease your pain accordingly. And for some things, there is some truth to that. And in the context of how we started with that area of that sort of triangle and then that trapezoid that looked at not just a nociceptive piece, but also a mood piece. And I think for many patients, they would say, well, that's kind of touchy-feely. How do we end up impacting that? And I will tell you, there's actually a number of different measures that can be able to impact that now are starting to become more broader, whether you're talking about potentially psychedelics or you're talking about ketamine or you're talking about transcranial magnetic stem. It's one of the reasons why our practice itself is broadened in nature, because we know now that we may be able to influence pain, not just through the use of injections or implantables or medications, but through a non-invasive manner that's able to use your own body systems, like what we're talking about, from endocannabinoid to neurologic to endocrine, to be able to improve pain by being able to key in to the right areas that improve mood and nociception without an injection and without medication. And that's what some of our other talks have been about. But before I kind of segue and make this too long, so yes, I think that you could target the nerves, but I think there's some other things that you could do too. All right, so going on, let's talk about some other things that are in place. I think we had that comment about the shoulder positioning and how free faller was not as bad as what we expected it to be. One of the things that's mentioned is the following: is pillows, mattress firmness, whether you have a partner that's kind of impacting your sleep and what the quality is. Quite frankly, I get this question probably more frequently than not than anything else, than what injection, whether I need surgery, whether I should be on some medication, is should I buy a new mattress or should I buy a pillow that's going to be able to help improve my pain? And the simple answer, which is not really a very satisfactory answer, is that it depends. First and foremost is, what is the problem and pain condition that you have? It's going to be drastically different for how and what you might have in terms of a pillow or mattress if you have facet arthropathy, meaning joints that are having some degree of arthritis, versus you having maybe cervical radiculopathy secondary to a disc, and how you might need to kind of have a different type of support. The other thing that I would say is that different people have different taste. So although you would think there's one right answer for that, it's not that, oh, I need to have an incredibly stiff mattress or a soft one, or I need to have a pillow that's catered in certain ways. About 3 years or so ago on this channel, we did a review of different mattresses that are effective for different people. And yes, there are ways to be able to have like therapeutic pillows that are able to give you natural support to the curvatures that exist in your spine that make things a little bit less disruptive. But the fact of the matter is, there are some people that have accommodated those curvatures because of what's going on with different portions of their spine and have become used to it. So you really have got to do more of a trial and error. There isn't any one right reason or right way. Okay, I think there's another comment that's coming in. Let's see. Okay, from Miss Wooten. Dealing with chronic pain, I'm a stomach sleeper. How can I avoid adding issues to current pain areas? Also, I've been recently diagnosed with mild sleep apnea. Can that increase problems? So some of this, I want to make sure that I'm addressing your question. But for those of you who are my pain patients, I'll address some of your questions on a one-on-one segment. So I'm going to speak in generalities as opposed to kind of answering your question right now, just so that I'm not giving medical advice to people that I don't have full details about and you don't necessarily feel comfortable with. Obviously, I had the pleasure of having Ms. Wooten be one of my patients. And again, thank you for joining. So I'm going to speak a little bit broader. So that way I'm not putting any of your information out there and making sure that I'm preserving your privacy. For those people that sleep on their stomach, I mean, it's a bit of a mixed bag because there's a number of different things that can be challenging. One of which is that you can have pressure in areas that you don't normally have pressure localized to. And that is parts of the shoulder girdle and pelvic girdle, right? And depending upon your overall weight and body mass index, those things can be challenging in terms of how you're able to kind of distribute that. The things that I think are important are, one, what's going on with the spine as a whole. Two, whether you have inflammatory processes that give you issues. So what I mean by that is, do you have rheumatologic issues or other things that are going to give you problems? 3 is, do you have other nerve issues, whether you have entrapments, compressions, things like that, that you really need to be able to kind of be cognizant of. The fact of the matter is, trying to be able to influence sleep position is incredibly tough. And one of the reasons why it's incredibly tough is because we're not awake to be able to control it. What you can try to do is to be able to hopefully find that position and maybe use pillows or the type of mattress to kind of see if you can kind of stay in that position. But 9 times out of 10, that's not what happens for most people. They'll kind of readjust throughout the night, which can be advantageous, but many times it's not. So at the end of the day, what I would say is, again, this needs a personalized solution. So if you're a stomach sleeper, there are a few different things that you need to be aware of. Simple tidbit from some of our reviews before in the past is a really thick pillow probably is going to be a little bit challenging, because what's going to end up happening is it's going to put your neck in a sniffing position. It's going to do some neck extension, and that's going to more than likely cause you some degree of compression and some other issues that are going to give you pains in particular within the areas of the arm and in the neck. We talk about the lower back. It also is going to cause something that's called lordosis, which is a curvature, if we would. So you have a natural curvature of the lumbar spine, and as things kind of worsen, you can have more of a curvature, which isn't always that great for a number of different reasons, because it can stress areas of the facets, which are the joints that we have within the areas of the spine. But it also can cause neuroforaminal compression, which is, you can have squeezes that take place where the nerves exit out from. So at the end of the day, what needs to be known is, if you're a stomach sleeper, you probably need to have that question answered by someone who knows you well and understands some of the conditions and battles that you're kind of fighting with. But thank you again for the questions. I really hope that you guys kind of keep them coming. I'll try to see what I can do about answering the best that I can. Okay. So we've kind of covered some different things with the endocannabinoid system. We've talked about different sleep positions. Let's see, as we kind of move through, what else is there. So these are the different systems, which are kind of fancy. Again, as we talked about before, there are things that are influence something that's called dopamine, which has various different effects, but it does everything from providing kind of that sort of calming state to it having other effects on how the cardiovascular system works. But one of the things that it can do is, you can kind of see that third to bottom line is that if it's upset due to pain, it can contribute to prolonged periods of sleep loss and disruption of sleep continuity. Meaning, so not only can it decrease your overall sleep, it can interrupt. So you're waking up and going back to sleep, waking up and going back to sleep. There are different ways to be able to look at and hopefully influence dopamine. And some of those things are pharmacologic, but many of those things don't necessarily need to be. And that'll be a topic for a different discussion. We take a look. We also mentioned the areas of opioids and whether they can cause a potential problem. And one of the things that you can see is the third line from the top is that many clinical pain conditions have prominent sleep disturbance, and those things like fibromyalgia and other elements can kind of cause this upset or dysregulation of the opioid system. And what ends up happening is that when you try to use a traditional pain medicine, because it's been upset, and even though it's coming from the opioid system, it results in pain medicines that are using an opioid pathway being less effective than what they otherwise would have been. And I don't think that that's what many people kind of realize, to say, hey, you know what, I hurt. I know I'm going to wake up in the morning, I'm going to hurt more. I may take something in the evening in order to try to be able to improve my pain. And pragmatically, that can work. But what it can do over a period of time is influence that overall system so that it's not as efficacious, particularly during the elements of the day when you're up and about. It can cause some challenges and issues on that end. And then when we talk about how to be able to provide a treatment, one of the things that they state in a number of the different articles is the following, is that cognitive behavioral therapy may be one of the most effective ways to be able to improve sleep problems. And then you can look at interventional things and physiologic measures to be able to improve sleep. And because these things are still kind of being worked out, that by treating both sleep and treating both pain, I think that you can be able to find the best nexus of the best options that can be delivered. So this is not like a one or other, but it's that chicken and egg dilemma that kind of goes back and forth, where you need to be able to manage both of those two things. And quite frankly, not just try to improve your sleep, through various different ways to be able to do that through sleep hygiene. And some of those things are trying to go to bed at the same time every time, trying to be able to know that you're going to hopefully be able to sleep for a number of hours are going to be in place, that you're in a cool kind of dark type positioning. And that is going to be regulated. If you're using electronic devices, that you're stopping that a half hour to an hour before. How to be able to address pain. Probably the best mechanisms are multimodal type treatment options. So you're not just relying on interventions, you're not just relying on medications, but you're doing something else that addresses it, both that nociceptive piece we talked about before, as well as the affective, meaning the emotional elements on how do you be able to kind of get that better. Many people say, well, how do I improve my mood? And I don't want to necessarily use medication. You can be able to do it with social support. You can be able to do it with other exogenous type treatments. You can do it with cognitive behavioral therapy. Those things are going to be things that can be able to give you the best benefit. And we talk about that mood, pain, sleep cycle. It's a vicious one. So we got to be able to find ways to be able to kind of break that. So that would be kind of the summary of how we're looking at sleep and pain. If you have other questions, please pose them and we'll be happy to try to answer it. And I always appreciate those of you who tune in. And what we hope to be able to do is to continue to help you endeavor to be able to how to punch pain in the face and get back to leading life that you deserve. Thank you so much for joining us, and tune in next week for another topic that hopefully is going to help you be able to take that element and condition that is bothering you, minimize it, and be able to lead the life that you deserve. Take care.